The following program is a paid presentation for the Center for Emotional Fitness and is brought to you by Dr. Leon Rosenberg.
This is the Doc Leon Show. Straight ahead, Dr. Leon Rosenberg of the Center for Emotional Fitness. And the word of the day today, innovation. Why Doc Leon? Why now? Stay right there.
Depression got you down. Are you losing the battle against depression? Not sure how to fight back? If you're sad, tired, or hopeless, call us to learn about participating in a research study. Our research study is testing an investigational medication for depression taken in addition to prescribed antidepressants in adults 18 to 65. Participants receive study-related medication and evaluations and compensation for time and travel.
I'm Dr. Leon Rosenberg. Call me at 866-DOC-LEON. That's 866-DOC-LEON.
Welcome back to the Doc Leon Show. With me, of course, is Dr. Leon Rosenberg of the Center for Emotional Fitness. Now, we do have a lot of stuff to get to today, but before we do, you got a new website.
Yeah, we finally rebuilt our website, cfef.com, and on it, as I promised last time we met, people can download my book, The Authoritative Guide to Psychiatric Diagnosis. There's a 75-second link to a video that tells about myself and about the research practice.
Don't gloss over that. The reason I wanted to point that out is it's going to tell a lot about who you are and what the practice is about. Because I don't think people get it. That it's not this big, giant, white building that's cold and clinical. This is much more of a comforting family type of an atmosphere.
It was a house that we converted into my office. So.
Well, that's what I'm getting at. But, and I think that we can we take a look at maybe a clip of that video?
Definitely,
We'll do that now?
Definitely. I think it's a great idea.
All right.
Welcome to the Center for Emotional Fitness. I'm Dr. Leon Rosenberg, the medical director. Went to Harvard as an undergraduate, trained at the Hospital University of Pennsylvania and Hahnemann University. I have a clinical practice here, treat people of all ages. I'm an adult and child psychiatrist. I use hypnosis for peak performance, for relaxation, for confidence, and for getting rid of bad habits. I also have a clinical research practice. I've done clinical research studies for over 17 years. We treat people with depression, anxiety, bipolar disorder, and other disorders. There's no cost for clinical research studies. We reimburse people for time and travel. And after the study's over, you get 5 free visits with me as well. The research studies begin with an extensive interview determining the exact psychiatric diagnosis. I wrote a book on psychiatric diagnosis, The Authoritative Guide to Psychiatric Diagnosis. Once the research study is over, we use the information from the research study during the 5 free visits to really develop a treatment plan. Often people do very well after the research study is over. The staff here at the Center for Emotional Fitness is hand-picked. Everybody here is very sensitive to the needs of people. By watching this video, you've already taken the first step to joining the fight against depression. Give us a call. We're available. We love helping people.
See, now that video really shows what the practice is all about. And it really, I don't want to use the word, it's not cold. It's a warm kind of environment. I'm certain that has gotten great reaction from not only staff but patients as well.
Yeah. And the important thing is that we want the passion behind this whole meeting and getting to greet people is that we want people to know that there's no reason to wait 8 to 10 years before they come and ask for help. And we have the research studies that afford us the opportunity to take an hour to make the correct diagnosis and do lab work and EKG at no cost to patients. And we're all about doing what's best for the patients, putting them in research studies, helping to make a diagnosis. And that's really the message I want to help you to get me to get across today.
We're talking about research studies, and certainly you can sign up for the research studies there on that brand new website, cfef.com. You can go to that. But research studies in general, and I want you to address this because it's important. Some of the people have commented, have asked the same question. It's got a bit of a bad rap. Why is that?
Well, unfortunately, some people do unethical things, and there's money involved in this, so people who've done unethical things have been caught. But if you think about the diabetes medication that's out there now, wouldn't have be out there if they didn't do research studies about that. The cancer medication wouldn't be out there. Prozac, Paxil, Zoloft, all those great antidepressants that have saved millions of lives wouldn't be there. And now we're testing the next generation of antidepressants, add-on antidepressants to Prozac, to Paxil, because they don't do the whole job. ADHD medication, bipolar medication for anxiety. It's critical that we want medication that's effective and safe in the marketplace.
Now we have to talk about who we're actually looking to talk to right now. And again, one of the things that we mentioned last time we talked was strictly depression. Now we're talking about ADHD, we're talking about bipolar, we're talking about depression, and we're talking about anxiety.
So we're talking to everybody, Eric. There's nobody out there who doesn't have an illness or know somebody who doesn't have an illness. 50% of people in a lifetime are going to have an illness of one sort or other. So if you're watching this video, there's going to educational purposes to understand how simple it is to have these understanding of these problems and how easy it is to have a problem. These are biological problems that run across every socioeconomic class, and anybody can suffer from depression or anxiety. It's not just from outside, these are biological processes.
And I think what it boils down to is there's no reason that people have to go, literally, as you said, decades not feeling well, not feeling right, or suffering from one of these issues.
Yeah, people think it's just me. That's my personality. I'm an anxious person. I'm a depressed person. I'm a moody person. These are illnesses. They're not personality traits.
So I guess the first answer to the question, why Doc Leon, why now, is because you're going to get better.
Yeah. Well, we can't guarantee that in this research.
Nobody guarantees that.
But you can guarantee an accurate diagnosis. Yes. That I wrote a book on psychiatric diagnosis, that authoritative guide. It helped me become a better diagnostician. I spent hundreds of hours simplifying diagnostic criteria so people could understand that. And we take time, my associate Dr. McManus and myself and my whole team works in day and night understanding diagnosis, understanding patients, and works to help them understand that there's a problem that they have, and it could potentially treatable problem.
Now, I threw out 4 words. Now, we're going to get to them in a second. I talked about ADHD, bipolar, depression, and anxiety. Each one of them needs their own little, really, time to be discussed and understood. Stay right there.
Depression got you down. Are you losing the battle against depression? Not sure how to fight back? If you're sad, tired, or hopeless, call us to learn about participating in a research study. Our research study is testing an investigational medication for depression taken in addition to prescribed antidepressants in adults 18 to 65. Participants receive study-related medication and evaluations and compensation for time and travel.
I'm Dr. Leon Rosenberg. Call me at 866-DOC-LEON. That's 866-DOC-LEON.
Millions of people suffering. 50% of everybody is going to have an issue or know someone who has an issue.
No, 50% will have an issue themselves.
That number is overwhelming. So,
right.
Why Doc Leon, why now? That number is just too much to
50% of people have a mental illness in their lifetime.
I want to start with ADHD.
Okay.
Certainly that is, people have heard so much about it, so much about the drugs that are associated with it. And you're doing studies now, and everybody thought before it was just for adults. You're doing for adults and children, obviously.
Right. Well, it was the other way around. Everybody used to think it was just for children.
Okay.
And then they thought kids outgrew it. But now we know that children don't outgrow it, that 4% of adults still have ADHD, and many of them were never treated in their lifetime. We're going to be doing an ADHD study in adults shortly. Now we're doing 2 ADHD studies in children, where people are going to get medication that may or may not work for them, but they'll get a diagnosis and follow-up treatment at no cost to them.
Now, there are some standard medications that are out there for ADHD.
Correct.
These studies, are they doing new medications in addition to what's in existence?
Well, the child study we're doing is testing medication that's already on the market. The adult study is testing new medication. But the studies vary all the time. We've been in practice for 12 years doing research studies. I've been a psychiatrist for 30 years already, and 35 including my training. But the studies change over time. New medication comes out, and we're doing new studies testing.
And really the bottom line is, especially if you're a parent and you think your child is having, what are the symptoms? What would the issues be?
Well, the psychiatric diagnosis for ADHD is simple to understand from my book. They can look it up, but to show you, the mnemonic can't focus is the inattentive ADHD symptoms. So careless mistakes are made, attention can't be sustained, necessary things are lost, scattered or damaged, trouble listening to others, failure to finish work or follow instructions, organization difficulties, concentration difficulties, usual and daily tasks are forgotten, and sounds, sights, or smells are distracting. You need 6 of 9 of those before the age of 7, plus impairment. And then the ones for hyperactivity as well.
And again, if you're a parent, and you can certainly go to the website, cfef.com, take a look at that. If you've got a child that has any of those symptoms, you say, you know what, my kid needs some help. That's why Doc Leon, that's why now. 866-DOC-LEON, cfef.com. I got to keep repeating.
How about my cell phone, Eric?
Oh, God. You're really going to give that cell phone out?
So in fact, we gave the cell phone out last time, 856-296-8547. And just yesterday, a wife of a patient saw me. She said, I was really upset you gave out the cell phone because I thought everybody would be calling you and you'd be so busy you wouldn't have time to see us anymore. In fact, a couple people did call. Some people called for donations. And people call for different things, but I'm available. 856-296-8547. We want people to reach out now. Well, they're not watching this live. They can call me while they're seeing these infomercials.
We talked about ADHD. Let me talk to you about bipolar disorder. Depression.
Well, with ADHD, I want to point out. So,
okay.
ADHD is often overdiagnosed, and so the beauty of the studies we're doing now, we have an ADHD study and a generalized anxiety disorder study, both in children. So often those two are confused. And if you only have one hammer, if you only know how to prescribe ADHD medication, let's say a pediatrician, a family doctor, they don't really know how to make these other diagnoses, everything looks like ADHD. And often the ADHD medication can make people worse who have anxiety or worse who have bipolar disorder. You want to be able to make these diagnoses. So the research study is set up in such a way, they only want people with one diagnosis. So they want us to take half hour to an hour making the diagnosis and studying the patient, making sure we get the right patient in the study with the right diagnosis so they have a better chance of their medication working. So we take that time. We spend the time with the patients and their families, understanding what's going on, looking at the criteria, teaching the criteria, so to make sure that in an ADHD study we have people with ADHD, whether it's like children, adults, adolescents, and an anxiety disorder study. If somebody, same thing, we want people with the right diagnosis.
Something else you've got to address, because I just got buzzed with that. When you sit here on television, and this happens a lot, people watch and they say, you know what? He really knows what he's talking about. I really like him. And you know what, you're coming off for him. I really want to talk, and they're going to say, I can't afford it. It's way too expensive. Somebody just buzzed me and said, how much is all that going to cost?
So the research studies are absolutely free. There's no cost to the...
well, okay, that's a good price.
Right.
And you got to explain it.
We're funded by pharmaceutical companies who want their drugs approved by the FDA, and there are different levels of research studies. The phase 1 in normals, phase 2 is safety, and phase 3 is efficacy, effectiveness. Mainly we do phase 2 and 3 studies. So we're studying, is the medication better than taking nothing at all? Or is the medication, let's say, additional to Prozac, better than taking just Prozac? So we're doing what's called adjunctive studies. We're on 2 meds or just 1 med. There's no cost to anybody at all. They're completely anonymous. People only use their initials. They don't have to let their insurance company know. They don't have to let their bosses know. They don't. Nobody needs to know. In fact, the pharmaceutical company doesn't even know their names.
And we're talking about this applies to all of the studies, whether it's ADHD, bipolar, depression, anxiety.
Absolutely.
Okay.
Absolutely.
And now again, I'm throwing those words out, and we were going to get to that. And we're going to do that next because we talked about ADHD. There's other issues, bipolar, depression, anxiety, and there's studies concerning all of them, but you know what? The proof is in someone who's been through them before. We got a special guest coming up, all right? Don't touch that dial.
Depression got you down. Are you losing the battle against depression? Not sure how to fight back? If you're sad, tired, or hopeless, call us to learn about participating in a research study. Our research study is testing an investigational medication for depression taken in addition to prescribed antidepressants in adults 18 to 65. Participants receive study-related medication and evaluations and compensation for time and travel.
I'm Dr. Leon Rosenberg. Call me at 866-DOC-LEON. That's 866-DOC-LEON.
Welcome back to the Doc Leon Show, 866-DOC-LEON, CFEF.com. And we're talking about ADHD. We're talking about bipolar disorder. We're talking about depression. We're talking about anxiety. We're talking about some pretty serious things here. And when we ask the question, why Doc Leon, why now? Help is right here. You know what? Let's back that up a little bit. With us right now is Karen. And Karen, you went through one of these clinical studies, didn't you?
Yes, I did.
Which one?
I went through a depression clinical study.
How? What was the experience like? Going through it.
It was good. I first called from a commercial I saw on television. I called the 800 number. I didn't know what to expect.
You're giving a plug for it now. I understand that, but that's very nice. What was your experience like?
My experience was very good. I didn't know what to expect. I was followed very closely. The staff was very friendly. Everyone is very nice, and they put you at ease.
Before I ask you what made you call, I mean, obviously there was something thing in the back of your head that said, you know what, maybe did you have any treatment prior to going through one of these studies?
I had treatment years ago for depression and anxiety that didn't totally take away all the symptoms.
Okay, and so you felt something, you said, you know what, Doc is on TV, I think that it might be a good idea to do that. Now, you went through how many studies, one or two, or which one are you in now?
I am in the same study in the second part.
Doc, how does that work?
So in the first study, and a lot of these studies, they're adjunctive, they're additional studies. So a patient would get an antidepressant, and to that, either they get a placebo or they get the investigational medication. And they don't know and we don't know. That's what's called a double-blind study. And that may last for 8 to 14 weeks or something like that. And then often these studies do a follow-up study where they'll definitely stay on the antidepressant and definitely get the investigational medication, because we want to see long-term safety studies. And that study can last a year, where they're coming, getting reimbursed for time and travel, it's still anonymous, but they're definitely getting a known and approved antidepressant and definitely getting the investigational medication. And I'm adjusting dosages based on symptoms. And you just said the other day that people over the summer had said that you've been best you've been in a long time.
Yeah.
Actually, I was going to ask about, and you just mentioned it, the compensation for time and travel. Were you compensated? How did that work?
Yes. Yeah.
So, in other words, what happens is when you go into this, that's the other issue, insurance. How did that work? Or do you need insurance to do this?
No, you don't need insurance. I currently don't have insurance, so.
And you're still in the second study. Now, there's one other thing, you just mentioned this to me, we're going to bring it up, but your experience obviously with Doc Leon in this study was positive, is that correct?
Yes.
Tell me about your son.
Well, my son had been misdiagnosed with ADHD and bipolar, and had been on medication that only made things worse.
How recently was your son evaluated?
He was evaluated about a month ago.
Okay, so this is like current we're talking
Yes.
about. Okay.
So I spent a lot of time evaluating him, and I asked about worries, and he's been worried for years and years, and worried that terrible things are going to happen to him or the world, and so he's just misdiagnosed, and the worrying was really his problem.
I'm bringing it up, and the reason I'm bringing it up with Karen is because you went through the process with Doc Leon, and obviously there was something that raised your comfort level to say, you know what, this is something that I feel comfortable with bringing my son into as well. Is that the case?
Yes.
Okay. So I know it's only been a month. How's he doing?
He's doing better. He feels better that he's involved in the study, and he feels he has something to look forward to.
That's the name of the game.
Well, I just want to go over this again. So what happens, he came in, he'd been diagnosed with ADHD and bipolar and probably oppositional defiant disorder as well,
Yes.
which is a classic. Spending time with him, it turned out the true diagnosis was generalized anxiety disorder, so GAD. He'd been misdiagnosed for years, put on the wrong medication for years. People hadn't taken the time, which we did together, the three of us, understanding every symptom, and it was so clear to him that he had been misdiagnosed, and the correct diagnosis, you could see the relief on his face just getting the diagnosis, because he was starting to give up hope. I felt that way, because the medication clearly was making him worse, so he was probably thinking to himself, well, this what's the future? Because things were just going from bad to worse.
And so, as a parent, I mean, obviously, I'm going to ask you to just to off the bat, or off the cuff rather, if somebody said, you know what, my child may be having that issue, what would you recommend?
I would recommend that they try a clinical trial. They really don't have anything to lose, and their child is very closely monitored. They're tested for any other kind of medication they may be taking, and all of that is very closely monitored.
Now, again, I appreciate you being here and sharing not only your own experience, but the experience of your sons with us as well. I mean, it can be difficult to talk about. However, I'm sensing there's a level of success that he's had and you've had also.
Definitely.
Okay.
Yeah.
Again, to me, that's the name of the game.
But part of the success here is just making the correct diagnosis. Instead of coming to a family doctor and just automatically saying, oh, your kid can't pay attention in school, he has ADHD, try this medication, or even psychiatry, HMO insurance or Medicaid insurance, or just waiting 6 months to see a psychiatrist. We see people in a week or two, they can get into our office, there's no cost to them, and they said we reimburse them for time and travel if they get into a clinical research study. If they don't qualify for a research study, we make a suggestion for a treatment plan on what they might do. And originally with your son, I wasn't sure that he'd meet criteria for a research study. We had to spend that time seeing what his problem was, and we spent that time.
How'd your son and the doc get along?
Great.
That's all I needed
Yeah,
to
he
hear.
likes
Why
your
Doc
sense of
Leon?
humor.
Why now? The answer is obvious. Why Doc Leon? Why now? 866 Doc Leon, CFEF.com. Don't touch that dial.
Depression got you down. Are you losing the battle against depression? Not sure how to fight back? If you're sad, tired, or hopeless, call us to learn about participating in a research study. Our research study is testing an investigational medication for depression taken in addition to prescribed antidepressants in adults 18 to 65. Participants receive study-related medication and evaluations and compensation for time and travel.
I'm Dr. Leon Rosenberg. Call me at 866-DOC-LEON. That's 866-DOC-LEON.
Welcome back to the Doc Leon Show, 866 Doc Leon, CFEF.com. Got the new website up there. You got to look at that video. If you're interested in any of the studies we're talking about, certainly there's plenty of links on there to click on. But, you know, we were just talking with Karen, and you had said something during the break. What happens after these studies? How does that work?
So for everybody, I offer 5 visits at no cost to them when the study's over. So for somebody like Karen, who's been doing very stable, the medication that she's on, the investigation medication, is not available. But what's innovative is that investigation medication is just a takeoff of some medication that's already available. So if she's on a certain antidepressant, I'll be able to get that for her, maybe from the pharmaceutical company at no cost to her, or if it's generic, very inexpensively, and get the study medication or a variant of that for months.
Now you're talking about the innovative areas of these studies. Now, I'm assuming now when we talk about this, it's ADHD, bipolar, depression, anxiety. We're talking about this in general for all of these studies?
Correct. So for every study, when the study's over at no cost, I see them for 5 visits. And for some people, those 5 visits can last a year because they've been in the study for a year. I'll see them every 3 months, get the medication available to them through the pharmaceutical company. When they come in, I'll hand them the medication in a big bag from the pharmaceutical company, and they'll see me in 3 months from then at no cost to them. No insurance involvement, nothing at all.
Innovative is that there's no cost. I mean, that's, alone that's innovative. And we're talking about the medication. We're also talking about you. We're talking about the experience at the Center for Emotional Fitness. It is not a normal, routine, clinical type of experience, isn't it? I mean, I'd like you to tell people what that feeling is like. When they call, everybody's all nervous about making that call to begin with. Why shouldn't they be nervous?
Well, they're going to call 866-DOC-LEON, dial extension 22. My nurse, Terry Marini, who I've worked with for 25 years, I worked with her at Memorial Hospital in Mount Holly, and she's very insightful and helps people to understand what's going on when they call us. She explains everything to them, helps determine if a clinical research study may be appropriate for them or maybe not. Sometimes, unfortunately, people have multiple medical problems that are unstable, they can't be in a study. But if people have are fairly healthy, a research study may be a great opportunity for them. Everybody has my cell phone number.
I don't know whether you can see this or not, probably not. It says Leon Rosenberg in there. Let's see if it connects actually. I want to see if I can actually get you to ring this. I'm going to put you on speaker. Go ahead, answer it.
Hi, this is Dr. Rosenberg.
Okay, all right, that's it. So that really
Finally,
is your
you called
number.
me, Eric, finally.
Again, we're talking about some things that affect millions of people. 50% of all people, 50%. ADHD, bipolar, depression, anxiety. Why Doc Leon? Why now? Should be pretty obvious. 866 Doc Leon, CFEF.com.
856-296-8547.
And that's the cell phone. You
Give
can
me a
call
call.
Doc Leon right now. Don't touch that dial.
Depression got you down. Are you losing the battle against depression? Not sure how to fight back? If you're sad, tired, or hopeless, call us to learn about participating in a research study. Our research study is testing an investigational medication for depression taken in addition to prescribed antidepressants in adults 18 to 65. Participants receive study-related medication and evaluations and compensation for time and travel.
I'm Dr. Leon Rosenberg. Call me at 866-DOC-LEON. That's 866-DOC-LEON.
This is the Doc Leon Show. We are just about out of time, but I want to remind everybody, adults, kids, there is a clinical study here, whether it's ADHD, depression, anxiety, bipolar. There is a research study that Doc Leon is doing now that certainly can help. One of the things that we had talked about, we mentioned it before, but it's worth mentioning again, how many people are affected and how long do some people wait?
Well, in a lifetime, 50.1% of people have one mental illness or another. And we haven't discussed the bipolar disorder that presents with either too happy, too giddy, too excited, or angry for days at a time. ADHD is inattention, impulsivity, acting without thinking, or hyperactivity. Depression is feeling sad, tearful, empty, or having lost interest or pleasure in things. So, and anxiety is worry. And for some people, worry, anxiety, nervousness, concern, stress, fear, what if this, what if that? And people have these symptoms for 10 years. It's a sin that people wait that long to go for help. We don't charge anybody to come and get diagnosed. If they don't meet criteria for a research study, I'll write out a treatment plan and send them to their family doctor. They get reimbursed for their time and travel. The medication is at no cost to them. The follow-up is at no cost to them. Call my cell phone, it doesn't charge. They can text me, whatever they want to do. I'm available to help people. People wait 10 years. The morbidity, the length of illness, and the unnecessary suffering that people have because they haven't had the right diagnosis. So we're going to educate them about the diagnosis, put them in a research study where they get further educated. They may not get better in the research study, but then we're going to follow up with 5 visits at no cost to them, use innovative medications, stuff that may be better than what's out there, and then when the study's over, provide them with medication that is available. This is something that people need to do. I'm trying to reach out to people, get them off the couch, call my cell phone right now. This is not live. You can call me right now, unless it's 2 in the morning. You can wait. But I'm available at all times. I have a not that busy a private practice because I cut back to make myself available for these research studies to let people have access to me.
And the
anytime.
help is here. And that's, what we talked about, the innovative pieces of the research. We talked about the medications that you can't get anywhere else. We talked about the fact that CFEF is a unique entity. In fact, if you want to see how unique it is, go to the website. There's a little video on there. We showed a little bit of earlier. Watch that's a tiny little thing. You're going to see a practice that's been set up really to make people comfortable. And of course, the bottom line is help. So, 866-DOC-LEON, CFEF.com. You can call Doc Leon on his cell phone. You know that. Final words, okay? As somebody sitting there saying, I think I'm going to make the call. Look, you got millions of people suffering, or millions of people who are affected by these issues. You got people there that are sitting and going, why should I call? Why should I call? What would you say to them right now?
So I've been blessed with the opportunity to help you out there. Give me a call. We want to help people. I have a great staff who's interested in helping people. We have pharmaceutical companies who want their medications on the market. There's no reason to have these problems. If you have any question that maybe you do or maybe you don't have a problem, it's completely anonymous. Nobody will ever know that you came to see me for a diagnosis at no cost to you. So this is a no-brainer. Give me a call, 866-DOC-LEON, 856-296-8547. We're located in Cherry Hill, easy access, high-speed line, taxi cab, whatever you need to get to us. We're working on that. We'll work something out.
You've made it easy. Doc, appreciate it. 866-DOC-LEON, CFEF.com.
The proceeding was a paid presentation for the Center for Emotional Fitness and was brought to you by Dr. Leon Rosenberg.
Businesses to watch.